Okay. Item number 8, proposed tobacco retailer licensing ordinance.
It just goes.
Do we have the speaker here? Is that you? Right over here. And just to let you know, when it comes to the portion for the audience to speak, we're going to limit you to 2 minutes rather than 3 because we've got a ton here. So just a heads up. And we'll start from the bottom up that came in first.
Evening, and thank you for the opportunity to present this evening. This is Paul Cummings, Director of the Alameda County Public Health Department's Tobacco Control Program, and my name is Rachel Gratz-Lazarus. I'm Senior Program Specialist with the Alameda County Tobacco Control Program. We'd like to walk you through the public health concerns surrounding flavored tobacco products that are marketed to youth, demonstrating the need for local policy solutions that limit youth access to tobacco, and provide an overview of the proposed tobacco retail licensing TRL ordinance. Tobacco use continues to be the leading cause of preventable death, killing over 480,000 people annually in the United States. The vast majority of smokers begin tobacco use before age 18, and research shows that the earlier a person starts using tobacco, the higher the risk of addiction and the harder it becomes to quit. The tobacco industry uses flavored tobacco to target youth and other vulnerable communities. We know that 4 out of 5 kids who have used tobacco started with a flavored product. And youth are more likely than adults to use flavored e-cigarettes. Flavors such as grape, menthol, cotton candy, and gummy bear mask the harsh taste of tobacco and are highly appealing to young people. Over 15,000 tobacco flavors are currently available on the market. In recent years, there's been an explosion of flavored tobacco products, which has fueled the popularity of e-cigarettes, as well as little cigars, among youth. While there's been a drop in youth use of traditional cigarettes, overall youth use of any tobacco product has increased in recent years due to flavored e-cigarettes. Here on the slide, you can see the surge of teen e-cigarette use nationally. Over the past 3 years, youth e-cigarette use has increased 135%. That's 1 in 4 U.S. high school students that have used e-cigarettes. Youth cite flavors as a major reason for tobacco use, with over 80% of youth e-cigarette users saying that they use the product because they come in flavors that I like. Here you can see strong youth preference for fruit, menthol, and candy-flavored e-cigarettes. And of note is an increase in the popularity of mint and menthol among youth e-cigarette users. Tobacco companies have historically targeted young people, communities of color, and LGBTQ communities with aggressive menthol marketing. Like cough drops, menthol numbs the throat, making the poison go down easier. And as a result, vulnerable communities bear a disproportionate burden of tobacco-related disease and death. Here on the slide, you can see the popularity of menthol cigarettes among teen smokers, and particularly high rates among youth of color. Menthol is a health equity issue. Cheap and discounted tobacco products allow the tobacco industry to capture price-sensitive consumers, such as young adults and low-income individuals. Tobacco products are often cheaper in low-income communities, in communities of color, and in those communities with higher proportions of school-aged youth. This is why raising the price of tobacco is one of the most effective strategies for reducing initiation, decreasing consumption, and curbing tobacco-related health disparities. Contrary to the perception that e-cigarettes are harmless water vapor, mounting research shows that they are neither safe nor harmless. E-cigarette aerosol contains many of the same toxic chemicals found in cigarettes, such as nicotine, formaldehyde, and lead, which are known to cause cancer, birth defects, and other health problems. The U.S. Surgeon General and CDC highlight that youth e-cigarette use can pose harm to respiratory health and brain development. Electronic smoking devices are now defined by the state as tobacco products. They typically have appealing flavors, the ability to be easily concealed and used discreetly, and high nicotine content. For example, the amount of nicotine in one Juul pod is equal to at least the amount of nicotine in a pack of cigarettes. Given the lack of regulation, many e-products contain misleading information on packaging, making it very challenging for a user, especially a young person, to know nicotine dosages or what chemicals they are consuming. The youth vaping epidemic is real and it's concerning. Data shows that for every adult who quits smoking using e-cigarettes, 80 youth initiate daily tobacco use through e-cigarettes. Electronic smoking devices are not approved by the FDA as a smoking cessation product. Local data shows that over 1 in 4 San Lorenzo 11th graders and over 1 in 5 Castro Valley 11th graders have used e-cigarettes. Over half of 11th graders from these school districts think it's very or fairly easy to obtain e-cigarettes, and nearly half perceive little to no harm in using e-cigarettes compared to traditional cigarettes. New county-wide data shows that the vast majority of current youth tobacco users in Alameda County report using a flavored tobacco product. Despite statewide laws prohibiting tobacco sales to minors under 21, over 2/3 of high school students who purchase e-cigarettes reported buying them from the store themselves or from someone else. Only 6.5% purchased online. This data is consistent with national trends, which shows that the majority of youth who use Juul flavor pods reported getting them from a physical retail location, like a store or a retail outlet. Youth decoy operations conducted statewide last year showed the percent of retailers who sold tobacco to minors. Tobacco stores and vape shops are among the highest offenders. A new 2019 state survey shows that nearly 50% of tobacco stores and vape shops failed to check ID when underage decoys tried to purchase vape products. Our understanding is that even this data may be underrepresentative, since tobacco retailers are more likely to sell to youth in the community who they know. Results from a store observation survey of 72 out of 115 tobacco retailers in unincorporated Alameda County shows that 99% of stores surveyed sell flavored tobacco products, and 97% sell menthol cigarettes. Half sell flavored electronic smoking devices. Price-wise, this same survey showed that 83% of stores surveyed sell little cigars and cigarillos in pack sizes as small as 1 or 2 for prices less than $2. The lowest price for a single flavored cigarillo was 49 cents, which is cheaper than the cost of a candy bar. Location of tobacco retailers also matters. Places with greater density of tobacco retailers tend to have higher tobacco use rates that lead to greater health inequities. Typically, there are more tobacco retailers near schools in low-income areas than in other areas. In unincorporated Alameda County, up to 71% of homes in the Eden area have walking access to tobacco stores, and up to 61% of these stores are in close proximity to schools. The best way to prevent tobacco-related illness and death is to keep youth and other vulnerable communities from starting to smoke in the first place. Strong tobacco retail licensing laws can protect youth from accessing flavored and cheap tobacco products and are crucial to preventing a lifetime of tobacco addiction.
Thank you, Rachel. So I'm going to go through and give you guys some of the details about what's in the actual ordinance. So again, the ordinance is designed to protect young people and reduce youth access to tobacco. It will require that any business in unincorporated Alameda County that wants to sell tobacco needs to get a local license annually to sell tobacco. And with the licensing process, it creates an enforcement mechanism to hold the retailers accountable for not selling to minors, as well as any other standards that the county approves. So TRL is something that's been done for quite a while here in Alameda County. 10 of the cities have ordinances similar to this. It allows for local jurisdictions to set the standards that they want. It holds businesses accountable for the behavior of clerks, and it provides an ongoing, consistent enforcement mechanism. So retailers would need to comply with all state and federal tobacco laws, so a violation of a state law would be a violation of the local ordinance. They would need to get a license annually, and then they would need to follow any of the local provisions that are passed as well. And I'll touch on those in a moment. So the federal and state laws, California laws to not sell to persons under 21. All taxes must be paid on products. No self-service displays. Fortunately, we don't see those really anymore. And there's no sale of loosies, so you can't sell single cigarettes. Cigarettes have to be sold in packs of 20. And the reason for that was decided many years ago, that selling them in packs of 20 made it more of a barrier for young people to initiate into tobacco use. So it's really important that cigarettes be sold in those pack sizes. So the local requirements that are proposed, again with the valid license, this would ban the sale of all flavored tobacco products. So that would include menthol cigarettes. It would include a variety, all of those flavored little cigars in the shiny packages. It would include e-cigarettes that are flavored. It would include chewing tobacco that's flavored. So all flavored tobacco products would be banned. It would also ban the sale of all electronic smoking devices. So this includes the devices, the e-juices, any of the components. It would not include any FDA-approved tobacco cessation products. At this point, that means nicotine patches and nicotine gum. As Rachel mentioned, none of the e-cigarette devices have been approved by the FDA as cessation devices. Separately, although they look a lot alike, this has nothing to do with cannabis. Completely separate ordinance, separate everything. It would also create pricing requirements for tobacco products. So packs of cigarettes would need to be sold for no less than $8. Little cigars would need to be sold in packs of 20 and also could not be sold for less than $8. And single large cigars or premium cigars would also need to be sold for $8, but they could be sold as singles. It would also prohibit discounts and coupons. All right. Finally, this would create some zoning and requirements. So new retailers would not be allowed to locate within 1,000 feet of youth-populated areas and not within 500 feet of existing tobacco retailers. It would also limit the total number of retailers to 1 per 2,500 residents. So that's the same ratio that the state uses for alcohol retailers. And it would prohibit any store that has a pharmacy from obtaining a tobacco retail license, so they would not be selling tobacco anymore. So the youth-populated areas that are included in the ordinance include schools, libraries, parks, playgrounds, youth centers, rec facilities, and licensed childcare and preschools. So, that's really hard to see. So this is the map of the county. The black dots, which I don't think are showing up that well there, are the retailers. And so the blue zone is the area around use-sensitive sites. So this looks, let me get to so this is now Central County. And again, so we've got the black dots, which are the retailers. So the purple spots are the use-sensitive sites. So the larger ones are parks. Some of them are schools and rec centers, et cetera. The circles around them are the buffer areas around the use-sensitive sites. So we can see that right now there are a bunch of retailers that fall within those buffer zones. those retailers would be grandfathered in. So existing retailers, regardless of location, would be allowed to get a license. New retailers would need to follow would not be allowed to locate within the buffer zones, and we would need to make sure that we were within the 1 per 2,500 requirement. So,
I have
yeah.
a question. So the pharmacies like the Walgreens and stuff like that, would they be grandfathered in, or are you taking that away from them?
So the pharmacies would not be grandfathered in. So, yeah. So currently, most of the bless you, most of the independent pharmacies already don't sell tobacco. CVS, which is one of the largest chains, they don't sell tobacco either. So the main pharmacies that are Walgreens and Rite Aid, and occasionally we've got some of the big box like Safeway or Walmart. Thank you. So the penalties for violations, a first violation would be a 30-day suspension from selling tobacco. A second violation would be a 90-day suspension. A third violation would be a 1-year suspension, and a fourth violation would be a license revocation. And I'll show a comparison with those in a moment with some of the other cities. If a retailer is alleged to have violated the ordinance, they can request a hearing before the Board of Zoning Adjustment, and any violations that are on a retailer's record stay on there for 5 years. So here's a comparison so the pack size here is for little cigars. Since for cigarettes it would all be 20. But so we see that our proposal is $20, 20 cigar pack size, and several cities in Alameda County, particularly the ones that have passed recently, have also passed that, and minimum price of $8. And this is pretty similar to what we have seen in other cities that have been passed recently. Here is a whole lot of numbers, but what you can see is that the penalties that we have set up of 30 days, 90 days, and 1 year, as well as revocation for a fourth violation, are pretty similar to what has been adopted in a bunch of the cities in Alameda County. The fees really vary between jurisdictions, and there hasn't been a fee set yet for this license, so we don't know what that would be exactly. And so that's us, but we're available for questions now if you have any. Thank you.
I have a quick question. Alameda, those 10 cities that have adopted this, has it been pretty easy to adopt, or has there been a lot of pushback?
It has varied. I would say in some cities we've seen a lot of people speaking up concerned about how it would impact retailers. In a lot of places we have really heard from a lot of high school students, sometimes middle school students, really concerned about their peers. They see their friends being hooked on this, and they get pretty upset about that.
I got a couple questions. I'm just going through this, and so we're going to vote on something that we're going to put a tax on something, or on these cigarettes or tobacco, but we don't know how much the tax is or the license fee is. So we're going to give you a check, a blank checkbook, to come back to these folks and give them a license fee that may be staggering. It maybe put them out of business. I'm just sitting here, I'm reading this, I don't smoke, never smoked, okay? But I know a lot of people that do. And I'm sitting here going, and I spent 40 years in retail, in grocery stores. And I'm sitting here going, well, geez, I don't understand. I mean, I can certainly understand putting restrictions on penalties for anybody selling anything, whether it's liquor, pot, cigarettes, e-cigarettes, to children. I mean, put them away. I have no problem with that. But I'm sitting here looking at this, I'm going, I know an 80-year-old man that just quit smoking cigarettes a couple years ago, and now he smokes this e-cigarette, and it's a hell of a lot easier to be around with an e-cigarette than a regular cigarette. And then when we go to the races, my pit doesn't have 500 cigarette butts laying all over the ground. So, I mean, I'm reading this, and I would hate to tell someone that's been around a long time that, hey, buddy, you can't have these e-cigarettes anymore because we don't think they're good for you. But he says, wait a minute, I've been around a long time. I think I can make a decision about what's good for me. Now, I understand with the children, 100%. Whether, nobody should be enticing or pushing the things on children, but I'm sitting here reading this, I'm thinking, what the heck are we talking about? We're talking about taking people's rights away and giving them...
Okay.
And, we don't know about the license. And do the easy cigarettes, do they have, this flavors, do they have a tax stamp on them like the cigarettes cartons do?
Yes.
So the government gets money right now for the e-cigarette product.
Excuse me,
So there's
excuse
a
me.
tax stamp.
Don't be speaking from the outside, please.
So there is a tax stamp.
Yes.
Like we used to have the little stamp on the cigarette cartons,
Right.
and yeah, okay. And so,
So can I just get back to the fee for a second? So a bunch of years ago, the California voters adopted Prop 26, which said that any fees, including licensing fees, could only be cost recovery. And so this idea of an exorbitant fee to say we want to try and chase a business out or something, that can't happen. It can only be the costs associated with administering and enforcing the ordinance.
have you ever seen a government program that shrank?
Yes, I've
I
seen
have
quite a
not,
few.
Because I will tell you that when we put a situation where, I will take in some of the agencies in the county where the departments have significantly grown and the permit fees have significantly increased. So if you go out and you say, we need more money to implement this because there are more people using the product, you can't tell me your department's going to shrink. You're going to go back and you're going to go to the Board of Supervisors. You're going to say, we need a few more bucks to enforce this. And you're going to get it. Now, so, I mean, I know how the system works in that regard. I'm just, once again, concerned when I have to tell a 60 or 70 or 40 or 50-year-old man or woman that, hey, you know what? We know what's better for you. You can't smoke these anymore. And I have a real problem with that.
Yes.
Yes. I'd like to make some comments.
Go ahead.
I think, like two sides on the situation. One is I'm a high school teacher up at Redwood Continuation, and there's definitely a problem with kids vaping up there and using these flavored cigarettes or flavored Juuls. We, in fact, had a whole lesson on it from Miss Ascension, who's here in the audience, who put it together out there. Anyway, our counselor. And it was very helpful. There's also some fear with the kids now that some people have died from the counterfeit cartridges. And we had a whole lesson about that as well, to tell them we don't encourage them to buy them, but if they do buy them, get them from make sure they're from a retailer and not from somebody on the street. So there's that problem, and I think that is the big major problem with e-cigarettes. However, I am a former smoker. I I'm usually chewing this, nicotine gum all the time because I'm addicted to that now. And I do know some people who have quit smoking from the use of e-cigarettes. And so I saw that statement, wherever it was in here, that, here it is, I circled it, does not include FDA-approved tobacco cessation products. And then I heard you say that that just means gum and patches. Is there a way for, adult people who have been smoking for 20, 30 years to be able to get these to help them stop smoking? I wouldn't want to be part of outlawing that.
Just wanted to clarify that the regulations are on the sale at the retail level. They're not on the possession or use of the product, so any adult smoker who's interested in purchasing them would be able to purchase online still. It's a regulation at the point of sale in the retail stores.
They would have to buy these online.
They could buy them online.
I have one other point, and this kind of seems like a weird one, but my son, who's 37, he smokes. He's very poor. He doesn't have much money, and I've seen him buy those single little cigarette or cigarros or whatever they are. And why? Because he doesn't have much money, and so he's buying those. And basically, it's looking like all of Alameda County just about is going to be pretty hard to find those really cheap cigarettes, right?
Potentially, yes. This isn't really part of the presentation, but the Smokers Helpline, they do online phone counseling. Our program gives money to the Smokers Helpline so that they'll give nicotine patches to Alameda County residents that call, because we want to support people
Trying to quit.
Yeah. And I think that you're right that a minimum price definitely has an impact on people who are price sensitive. Yeah.
Thank you.
Yeah, I've got some questions. So the thing is, and I'm kind of on the fence here with Chuck, because the reality is that as soon as you implement a process, and I've been here long enough, and we've started enough things that start off at a penny and end up being at $1,000, and so as far as starting something, I'm more cautious about it. I personally do not care for vaping in any way, shape, or form, or cigarettes, but that's just my take on this. But so looking at the statistics, though, at 74% that you're saying is purchasing at a physical retail location, but then you have a 52% social source, and then you got 6% on the internet. So that doesn't equal 100. It's actually a lot more. But my comment to you is, how do you plan on managing it? It will shift. If you take something away, and it's already gone too far at this point, and we're not controlling the entire United States here to stop this. How are you going to manage this when those numbers shift and you've penalized the retailers, and we're causing these fees and charges where now we've minimized the purchases of the retail sales that they can walk into, and now you've increased internet sales you have no control over, or the other side of this, and it moves over. Now what? I mean, you must have thought about this. So, I mean, what's the plan? Because step one is going to be to implement something like this, but it will shift. So then what?
We aren't seeing that young people have been purchasing products online. That's something that's been stated a lot, but what we're seeing is that young people are purchasing the products either in stores or locally. And so, based on that, reducing the number of products available in the environment should reduce youth access, should reduce youth consumption and youth initiation.
Well, I think that the control over the flavored and some of the things that are being proposed, I mean, I agree. So I'm with Chuck. I mean, the thing is, once you get started, it is what it is. However, you're not going to get them back. And the problem is that they're probably not buying them online because they still have to send them to their home, which their parents live in, and they're circumventing the system. But that's not going to stop them when they turn 18 or 20 and they move out, because now the damage is already done. But I'm concerned, my same concerns are like with Chuck, because once you get your hand on this, it's going to turn into just like everything else. We have got so many ordinances and regulations, more than any other part of the United States. Just to be able to implement anything here is extremely difficult. So what does this actually do? And so that's kind of my point.
Okay, you can go ahead and have a seat. We have a number of questions here from the audience. First will be Nick McMaster, following will be Ricardo. I can't make out your last name.
Simmons?
Ricardo, are you here? Yeah. Okay, and you'll be limited to 2 minutes because we've got a ton of these, so go ahead.
Good evening, council. Mr. Ritchie, you had to put me up first.
We went from.
I'm kidding. I'm just a little nervous. Good evening, community. My name is Nick McMaster. I'm the Director of Student Services for Castro Valley Unified School District. I was born and raised in town. I've worked for the school district for 16 years as an administrator at the high school. And now within my current role, one of my main responsibilities is campus safety. I get out to all the campuses now, specifically the secondary campuses where we see a little bit more of the attempts at, trying on adult behavior. I'm speaking to you in hopes that you take a strong look at this ordinance and that you consider moving it forward. I know there's a lot of data presented to you. Maybe it adds up, maybe it doesn't. I can tell you that most of the data specific to Castro Valley Unified School District was from surveys 2 years ago. We're actually completing those surveys right now. In the last 2 years, I've seen a dramatic increase. I have seen countless stories. I've seen addiction in our youth. I have hung out in bathrooms to make sure that they are used properly because they become a hotbed of vaping. We used to worry about students across the street smoking in neighborhoods, and now we're worried about students vaping in classrooms. I walk down a hallway indiscriminately to see a student step out, hit the vape pen, 2 steps out of the classroom. I've seen students zigzag between bathrooms before school even starts over the course of 30 minutes because they are addicted to nicotine. They are stealth. They are flavored. They are made for adults. They are made for adults. I don't want to limit adult decision. I don't have the unilateral power to do it, but I would tell you that they are ending up in the hands of our youth.
I have a question for you really quick before you step away. So do you believe or feel that this regulation will help the problems that you're seeing in the schools?
I believe that it is the duty of adults to protect children from themselves a lot, and I believe that we have to do something.
Okay, Ricardo?
2 minutes. Okay, so I just wrote down some notes. My name is Ricardo Cimentel, and I'm the director of Project Ride, which is a creative and innovative program that blends custom car shows, bike shows with youth leaders who want to promote and be involved in public events and bring their families and brothers and sisters out too without having to worry about secondhand, third-hand smoke. Project Ride has been active for about 15 years and statewide, and more recently in Alameda County Incorporated. And today we're here because a tobacco retail license is critical to our work to keep kids safe from more than I think there's about 15,500 tobacco flavors in existence today, and kids are getting hooked on them, as this gentleman had already articulated. But we're here because we want to support our youth leaders to help fight and sustain a vibrant community and support stores and help stores not fall prey to the predatory practices of tobacco retailers. And I just want to let you know that we work daily with kids at some of the high schools, and the same thing with what that gentleman said. We're talking to them all the time about the consequences of their actions with tobacco and their concerns with their friends and where that's going to lead to. And so we're mobilizing young people and supporting them to go out and activate tobacco-free events, but in the meantime, they are also struggling with trying to help their friends and classmates overcome addiction problems already. So I do feel that TRL would help us locally minimize the impact of tobacco flavors or tobacco products with our young people. So thank you so much.
Thank you. Okay, next, David Alja, and following David will be Stephanie Guzzi.
Good evening, Honorable Council. My name is David Alga, owner of Valley Vape Club on Castro Valley Boulevard, and this ordinance will close my business. For a year and a half, we've been a beneficial business at Castro Valley, converting hundreds, if not thousands, of smokers to a proven 95% safer alternative to smoking cigarettes. Mac Board, we've done this before. I stood here at this library years ago fighting for the store that preceded us, Ready, Set, Vape. For 5 years prior to us opening, they occupied our building, the first vape shop in the area, welcomed with a ribbon-cutting ceremony and commendation by Supervisor Nate Miley and then board member Bob Swanson for helping people quit smoking. We share the same goal, to help our residents live longer, healthier lives through the use of harm reduction products. We are not big tobacco. We are against big tobacco, and we strive to reduce the unnecessary deaths every year from smoking-related illnesses. In 7 years at our location, we've had 0 violations and follow all of the current laws that need to be enforced. So why are we going through this again? We are welcomed into this area with the full support of the board, getting people off deadly cigarettes to live healthier lives and improve the health of our community. Is it because youth are vaping? The 2018 tobacco survey showed that the youth who have never smoked and are under 18, the use rate is a mere 1%. We can work together to reduce that rate even lower, but prohibition is not the answer. We're an adult store selling adult products, and you have to be 21 to walk in our doors. Don't be fooled by the wolf in sheep's clothing. The public health groups are directly funded by tobacco taxes. Their goal is to wipe out vapor products and keep people smoking cigarettes. It is plain and simply blood money. I invite each of you to come to my store to meet our customers who are happy to have left their deadly habits, showing us pictures of their family and kids as reason why they switched. Together we can fight big tobacco, but if you ban our products, our customers will have no choice but to walk across the parking lot to buy cigarettes. Banning vapor products will be a huge win for big tobacco. Is that your goal here? Increasing cigarette sales and cancer? We hope not. We ask that you remove vapor products from this ordinance. You're wiping out the solution instead of the problem. As long as cigarettes exist and 30 million people in the U.S. still smoke, we're an important asset to Castro Valley. Thank you.
Thank you.
Hello, everybody. I'm Stephanie Guzzi. I am here to support the freedom of choice of adults who smoke flavored e-oil cartridges. There have been flavored tobacco products for centuries. Have you ever been into a pipe shop with all the alcohol-infused tobacco? Then there's the chew, the snuff tobacco products that is flavored also. I agree that the tobacco companies are behind this with all these flavors and advertising to attract the children and some adults. Why is Juul and others are allowed to advertise on TV? They banned any tobacco advertising on TV 49 years ago. Maybe you should ask why they got around this law. You may think you're doing the right thing by banning flavored e-oil cartridges. However, you're stepping on people's rights and freedom of choice. Thank you.
Okay, next person is Saeed. I can't make out that last name, Saeed. And following Saeed will be Chris Garland.
Good evening. My name is Golche. I'm a small business owner, very close by. Reason I'm here is basically trying to support and try to speak on behalf of other small businesses like myself. I'm totally for some of the programs that health department is trying to implement. I have children myself, and I'm totally against children and high school students or school students in general smoking, tobacco products. But one of the things that that we have to think about also is the fact that in today's world, especially younger generation, they're very much into shopping online. So by limiting the small businesses selling these products, we are basically promoting the sales online, which is much easier for them to, receive. A lot of the small businesses, like my business, their livelihood depends on these kind of products. By cutting it off all these different types of products, basically it puts a lot of the small businesses out of business. My suggestion is if there's some ways that we can enforce the law by trying to implement a system that the retailers that are selling these kind of products, they have to follow the rules and regulations set by the Department of Health and the Council.
Thank you.
Thank you.
Chris Garland, and then following Chris will be AJ Rabosa. Chris Garland here? Okay, AJ Rabosa. Elsa Casanova? Okay.
Good evening, Castro Valley MAC board members. My name is Elsa Casanova. I'm a coordinator for Bay Area Strength Through Activism, also known as BASTA, which is a group of over 100 Eden area residents, including parents and youth from Castro Valley who are concerned about the health of their community. I think the presenters tonight did a great job at presenting what the problem really is and how prevalent e-cigarette use among youth is. So I'm not really going to bog you down with too much details on that. But I do want to let you know what are some of the most important things to our members. Our members believe it is very important for us to put some kind of restriction on the sale of flavored tobacco products because we know that they do entice youth. The tobacco industry uses tactics to market to youth, such as selling vape flavors that appeal to them, including mint flavors. Flavors hide the harsh taste of tobacco, and youth perceive it as safe. Over 40% of Castro Valley Unified students say there is no harm or only slight harm to vaping, even when used several times a day. The tobacco industry also makes sure that these products are easily accessible in local stores. As you saw in the PowerPoint, up to 61% of stores are near schools where young people frequent every day. And these tactics are used by the tobacco industry to manipulate the decisions of young people to consume tobacco products. These tactics create new generations of lifetime addicted customers. I've heard quite a few people mention that, e-cigarettes help adults quit, but in actuality, we know that the results on the effectiveness of e-cigarettes as smoking cessation devices has not been proven effective. So thank you for your time.
Okay, thank you. Next is Melissa Ruiz, and then Nina Asuncion.
Good evening, my name is Melissa Ruiz, and I'm the Youth Advocacy Coordinator with Bay Area Strength to Activism. I speak to youth from all over the area about this issue who know about this policy, and they share with me that they're tired of the hostile environment that vaping has created in their schools, when at times there has been times where they have found almost every single bathroom closed because of this vaping epidemic. Their anger of the targeting of youth by the tobacco industry to hook their friends with toxic flavored products, and they're generally concerned for the health of their friends. And they're also really tired of how easy it is for you to walk into liquor stores near to the schools and purchase these toxic products. You also have to remember that data shows that in the United States, high school students are the primary users of vaping devices, not young adults from 18 to 24 years old, nor adults older than 24 years old. And also, when this policy was implemented in Berkeley, the sales to youth dropped from 88% to 4% of youth. And just to mention about the little cigar thing that you mentioned today, well, I know it's a concern that it might no longer be affordable for people who don't have a lot of money, but they will no longer be affordable for youth. Just today, I saw a group of 15-year-olds across the Ashland Youth Center smoking out of a backwood, one of those little cigars, because it is that accessible and that affordable to get those products for teens. Thank you.
Thank you. Nina?
Hi, good evening, everyone. My name is Nina Sanchin, and I am a counselor for the Castro Valley Unified School District. I've been a counselor here in this district for about 15 years, but I've been working with teens for about 20 years. I have to say that smoking is an epidemic in our area. I show some kind of support for some TRL form of law. I've been working in the community and I've seen this evolution of smoking with our teens. We thought 5 years ago that we had a handle on this, and then all of a sudden tobacco flavored cigarettes, vaping had come and ruled the show. 3 years ago, it was pens. Now it's lipstick devices, USB devices. There are actual hoodies now that really hide these devices. So really, teens, they are smoking right in front of our faces without us even knowing. Even in our houses, even in our classrooms, in our bathrooms, this is an epidemic. And so, again, I'm not here to attack businesses. I'm not here to say that adults don't have the freedom to do whatever they want. But really, this is a community issue. We need to protect our youth. Every day I tell our youth, make smart choices. And we all know that they are not going to they're not going to make the smart choices. But the thing is, we are all adults here, and we have to help protect our youth and make the smart choices for them. So really, as a community, we really need to come together and figure this out. If it's through some TRL laws, great. Whatever, but we got to figure this out. Thank you.
Thank you. I'm going to have Council Member Carboni read an email that came in, and on behalf of this subject, the person couldn't be here.
This email came in from Eric Brooks of Castro Valley resident. Please don't ban all vaping products in unincorporated Alameda County. I live in Castro Valley. I voted for Mr. Miley many times, but only have not smoked in 3 years. I have not smoked a cigarette in 3 years. Yes, I still vape nicotine, but I use it weekly at its weakest I can buy. I support my local business, the Vape Club, instead of buying supplies cheaper online. Please allow me to choose to pay my local taxes and my vaping needs here in Castro Valley. Also, banning legal sales of tested cannabis cartridges is a poor idea. That's not even what's on the books at the moment. And increase the sales of potentially dangerous black market carts. I didn't have the time to meet the meeting, so please read my email instead. Eric Brooks. So there you go.
Laura Kaiser, and then following is David Meissner, sorry. Go ahead.
Oh, thank you, MAC Board, for listening to this important topic. I've lived in Castro Valley for the last 31 years, and I'm here on behalf of my grandson, who is 6. I also am a paraeducator at the high school, and I've worked there for over 10 years. And I'm extremely concerned about the increase in the youth and how much and what's going on. In the course of my day, I overhear students talk about how easy it is to buy vaping products. I couldn't believe one day when I overheard a student who said, yeah, as he walks to school, he's able to go in and buy the oil, no problem. So I in a way, you know, this just popped up. I didn't realize this was a problem. But I kind of blame you for letting all these smoke shops come into our community. What is the deal here? I go to San Ramon, I go to Danville. You don't see smoke shops on every corner. You don't, but in Castro Valley, you do. Why is that? And not only are they here, they have these giant light bulbs in the window. I drive down Grove Way, and I'm blinded by light bulbs. I'm like, what is that? This is not the Alameda County Fair. This is Grove Way. Why are we treating our community this way? I'm sorry, it's not right. That little white light bulbs all around a window, that looks like, that's a cool store. I want to go in there and check it out. So turn down those lights. Why don't you take back for our youth, for my grandson who's 6? I don't want this to be a problem for him. I'm sorry there's addicted people out there. I really am. But let's stop this with the youth. Okay, why continue it? And I'm sorry you invested in this product that's hurting people. Kids in comas, who knows what the next, okay, now it's vitamin E, okay? That was put in there illegally. What's the next thing they're gonna put in there? So yeah, get some people to regulate this. I don't care how much it costs. I'm here for my grandson, he's 6.
Thank you. Okay, next is David. And then following David would be Jay Johnson.
Can everybody in the back hear the speakers? Can you hear? Okay, so make sure.
Last I remember, I've seen also a lot of stores with lights called liquor stores, and they sell different flavored things too. We're going to start banning alcohol because kids drink underage too. I'm sorry, I digress. I was a smoker for about 30 years, and along came this really cool product, vape, that has flavors because, quite frankly, tobacco flavor doesn't taste all that appealing. You know, I don't smoke cigarettes hardly at all anymore, and I think the vapor products to being able to facilitate that. You know, I'm responsible enough to not to go and give my vapor products to any underagers. I don't think that my friend Dave does that either. I know, in fact, I know he doesn't. You know, what's the deal? You guys can't teach your kids well enough to keep them out of, you know, vape shops? Oh.
Excuse me. You need to keep your comments to the council,
Okay,
not
fair
the
enough.
audience.
Fair
Okay?
enough. Okay, well then my comments to you is that if it's up to, you know, law-abiding adults to make their own choices about their own health, then it really should be left to us to make our own choices. You know, if you take that away from us, sure, it might take it away from some of the kids. Do you think they're not going to be able to get it? They'll just go to another town. They'll get it. They'll buy it online. They'll get these bootleg stuff that's causing problems and health issues. You know, it's kind of funny that you aren't going to try and regulate the cannabis. I suppose pot's okay, but vapor's not? Or is that to keep the, you know, millennial snowflake kids from acting up?
Jay Johnson. After Jay will be Yana Reese.
It's actually Joy Johnson, if you're wondering why Jay's not standing up here.
Oh, okay.
It's okay. My handwriting may not be perfect. So my name is Joy Johnson. I'm a local mother in the community of 4 children, one of whom is standing by my side, and very bravely, and I'm very proud of her. My kids range in age from 13 to 19. I also happen to be a licensed child psychologist working with kids for the past 12 years. I'm here because I'm worried about the kids and because adults are adults, and I'm not interested in limiting rights of adults. I'm interested in protecting our children who are far more vulnerable than the adults. If we're going to prioritize the adults quitting cigarette smoking over preventing the beginning of smoking in children, that doesn't make sense to me. I'm all about early intervention. If we don't help protect our children now, they're gonna grow up to be the adults that can't quit smoking. My brother is a vapor and a cigarette smoker. He does both now. And he started when we were in high school smoking menthol cigarettes just because they tasted good. I also want to echo what was said previously about the number of vape shops in Castro Valley. This is kind of funny, but kind of not. I think when the number of vape shops in a town outnumber the number of Starbucks, we have a problem. Kind of funny, but also kind of true. I have a bunch of statistics and stuff written down. I think those have all been spoken about. And I'm just going to ask that you, is that a warning or is that my end?
That's your time.
Oh,
Thank
she
you.
agrees. I was going to give her time, but I didn't.
Thank you.
Sorry, baby.
Okay, next is Yana Reese. Following will be Maria Navarro.
Hi, thank you for hearing all of our comments today. My name is Yana Reese. I'm Advocacy Coordinator with BASTA, Bay Area Strength Through Activism. I think when we talk about tobacco, what gets lost in this whole conversation is it's not really about the tobacco, right? I'm part of the department called Equity Initiatives, and tobacco is just the tip of the iceberg of inequity in our community. Every single person here, you all, the vape vendors, as well as the community members, are all victims of a multi-billion dollar industry. They target us, and I just want to point out a couple of interesting points from tonight. The density and poverty connection here, the reason we have so many vape shops is not a coincidence. They target low-income communities and communities of color, and they target youth. Flavors are not just more fun. They're made and manufactured for children. Because when you become addicted to anything as a child, you are more likely to remain addicted, and you cannot quit. Menthol is one of the main reasons why people struggle to quit, is because it has an anesthetic effect, makes it easier to consume, and actually makes it easier to consume higher quantities of the nicotine. I just want to point out some of the comments earlier today were read off of something that was clearly printed, and those were scripted, okay? The community members do not have scripted comments. Everyone here is speaking for themselves. About the age argument, I'm really glad to see there are so many pro-choice people here. I'm sure everyone who thinks that 70 and 80-year-olds shouldn't be told what to do are also 100% pro-choice. That's exciting news. E-cigarettes as a method of cessation does not work. That is a tactic by the tobacco industry to have us here fighting over what we all know is the truth. Look at the folks who are, you mentioned about your son. That's not a coincidence that he's low income and can't afford the cigarettes.
That's your time. Sorry, that's your time.
Thank you.
Thank you. Next, Maria Navarro. And then Sarah Rosetto.
Hola, buenas noches. Soy María Esther Navarro, vivo en Island. Estoy en el grupo de Basta y vengo a hablar acerca de lo del tabaco.
Hi, good evening. My name is Maria Esther Navarro. I live in Ashland, and I'm here to speak to you about the tobacco.
Pues yo estoy preocupada por mis hijos porque ya algunas veces me los han, les han invitado, ofrecido el tabaco, entonces yo estoy preocupada porque se me puedan enviciar y también no nada más especialmente por mis hijos, sino por todos los jóvenes de nuestra comunidad de Island. Porque
I'm here because I'm really concerned about my children, and not just about my children becoming addicted to these products, also for every child that lives in my community.
Y vengo aquí para pedirles que que nos escuchen, porque es algo muy importante, porque yo no quisiera que hubiera tanta enfermedad de cáncer para nuestros hijos y para nuestros jóvenes del futuro de nuestro país.
And I'm here to ask you to please listen to us because I don't want to see our young generations being and having to deal with diseases like cancer.
Y esperamos que, y gracias por estar aquí para que nos escuchen y esperamos que nos den una buena solución para que haya una ley para que nuestros hijos menores de edad no lo puedan consumir.
Thank you for listening to us here tonight, and I hope you can help us protect our children.
Thank you. Okay, next, Sarah Rosetto. Sarah here? Okay, Olivia Zakis.
Oh, I'm also speaking for Zara. She had to step out. My name is Olivia.
Get a little closer to the microphone.
My name is Olivia Zakis. I'm here from the high school with the program 2P, which stands for Tobacco Use Prevention Education. I'm here to talk about the tobacco retail license. It's really important to me because it's hard to see all of my classmates being really addicted to these products. There are times where I have to go to the bathroom, but I can't even wash my hands because there's people standing there smoking. So I have to go all the way to another bathroom at campus just to wash my hands. It's really concerning because I've seen so many people and kids lose their education because they're focused on stuff that isn't important. They're focusing on vaping and smoking instead. And it's really hard to just watch them throw their education away. We're asking you to help because it's important to us. There are a lot of kids that just don't care anymore and are more focused on vaping and smoking and stuff. And we just would like your help.
Thank you. Okay, Jamie Ireland. After Jamie will be Marnell Timpson.
My name is Jamie Ireland. I'm a longtime Castro Valley resident, educator, and mother of two daughters, one at Creekside and one at Castro Valley High School. This is not a problem that we can educate ourselves out of. Our children are being targeted by the tobacco companies to be the next generation of smokers. We adults need to do everything we can to stop this epidemic of more than 5 million youth who are vaping. Please pass the strongest ordinance you can.
Thank you. Marnell? I'm sorry? Which one do you want to be, the abatement? Okay. Okay, we got Zachariah. And after Zachariah will be Muhammad Ali.
How's it going? I'm speaking on because there's a lot of people who have a problem with the kids, the youth getting e-cigarettes. There's no problems. I haven't heard not one problem against grown-ups getting it. Matter of fact, it's a lot of benefits to grown-ups getting e-cigarettes because it helped my father, helps a lot of my uncles. I had uncles that passed away from cigarettes, and now my father and other uncles and other family members and thousands of my customers use e-cigarettes, and it helped them quit smoking cigarettes, and now they feel better. Their lungs feel a lot better. They can run. They're a lot happier from quitting cigarettes and switching over to e-cigarettes. For the youth, it should be more penalties on business owners who sell to youth. That's the best way to get youth out of it because you cannot ban the whole electronic vapes, to save the youth, but then you got millions of adults that's dying off cigarettes because they cannot vape. So it's better if we just have a higher penalty for whoever sells to youth, and that will for surely cut down on the youth, on the selling to youth, because now it's just like a slap on the wrist. What the worker gets a misdemeanor or something like that, but it should be on the business owner too. It should just be higher penalties for youth selling. That's all I got to say, because that's the only problem everybody has right now is just the youth. So why don't we just higher the penalties? That's about it.
Thank you.
Thank you. Muhammad Ali? Okay, oh, is that you? Okay.
I've owned my vape shop for almost 5 years. I haven't had not one violation for selling to a minor, not one, over 5 years. You guys are saying, well, they're saying that they want to let them buy it online, but buying it online eliminates the face-to-face interaction between the customer and the store owner, where I can know if it's a child or underage, and I can ask them for ID and see if it's really him or not. But online, they can just steal an ID and then order what they want. And you taking it from the brick and mortars where we can all work together, and you can come and check and regulate in the stores and pop up whenever you want. You're going to take it from us, and that's going to go straight to the people on the streets. That's going to make it in bathtubs and sell it to whoever, and there's no way you're going to be able to regulate that. Just like every other thing that hit the streets and became outlawed. And the vitamin E that everybody's complaining is killing people, that came from wax cartridges. It wasn't in the vape juice. And why are they targeting the menthols and the cigars, but they're not targeting the cigars itself or the tobacco itself? That just tells me that maybe Big Tobacco has his hand in all this. It doesn't seem right for you to take this and take that. But if you take it from the stores, they will be on the streets, and the kids will get it from anybody who's selling it. Because they're not going to worry, oh, am I going to get fined? They're just going to sell it. They want the money. They don't have, you can't tell them nothing, because you can't take nothing away from them. Me, you can take my business away from me, but him, you can't. Just like all the other drugs and all the other stuff in the streets. There's not enough cops to go around checking who's selling vape juice, who's selling heroin, who's doing this. There isn't. And if they come to me, I told you, not one violation have I had in almost 5 years. And I shouldn't be penalized over what other people think and this and that. That's how I feed my family, and I take care of my business, and I don't want no kids to have no vapes around me. I don't want to see it anywhere. Thank you.
Okay, thank you. Veronica Conley, and then Liz Williams. I'm sorry, not Liz Williams, Charles Pissarro. So Veronica, then Charles.
My name is Veronica Connolly. I am a member of the public that uses vape. It has helped me quit cigarettes. I was one of the teenagers that were, using tobacco products behind my parents' back and stuff like that. Till they kind of investigated, asked me questions like when I got home from school, how was your day, face-to-face dinner table talk. Can't hide stuff very long from parents that are really involved in what their kids are doing, not allowing their bedroom doors to be locked up. And, there's a certain level of, privacy and, you should be checking in on that. But basically, I feel like it comes down to accountability in, different aspects. What everybody's saying about, the businesses that aren't IDing, there should be, bigger consequences for people who violate that. But I feel like we need to stop making excuses for our kids. I know we want to help them. I'm a mother of two myself. I know that we want to do anything we can to keep them safe. However, I think it's a little bit more efficient to teach them accountability for their actions, knowing that what they're doing, if they get caught with it, that they're going to get, consequences from that too, instead of oh, it's their fault and their fault and their fault, and they're, meanwhile getting away with it like they're, oh, poor victim. When you're a teenager, if you're not supposed to have something because you're not of age, you're not supposed to have it. So at that point, might as well get rid of flavored alcoholic beverages too. Or maybe even flavored condoms and stuff like that, Everything flavored, take that away, because it's got to be even in that case, Or we could check lockers at school. We could have volunteers from the community that are parents that care about our kids, check in on bathroom breaks, stuff like that.
Thank you. Okay, Charles, then Liz Williams, and then Arlene.
Charles Pisano, MEV member.
former smoker. I smoked 4 years, whatever, began when I was 13. Pretty dumb. And I got out of it way before vaping ever showed up. For the responsible adults who are selling vape products, etc., and for the responsible adults who are using it to get off of cigarettes and just control their urge, that's great. What I'm hearing is a conflict between businesses that will be in trouble, some will fail, some will prosper because they can be responsible, smart owners. I hear a lot of concern for children. I share it because it's really easy to get addicted when you're young and you're not thinking clearly. Trust me. Finally, I hear the concern about government overreach, and that's an important thing to consider, that any regulations are fair and across the board and give the responsible retailers a chance. Thank you.
Liz? Liz?
Yes.
You got it.
Good evening. I'm Liz Williams with Americans for Non-Smokers' Rights. I encourage you to support the proposed tobacco retailer licensing ordinance for the county, especially ending the sale of flavored tobacco products. The goal of this whole proposal is really to reduce the access to the products that are enticing young people to become addicted to nicotine and creating a healthier environment for all Castro Valley residents, creating an opportunity for children to make healthier choices so they don't end up with the consequence of a lifetime of nicotine addiction. This issue is so important because, as you've heard, the flavors really are the key for attracting the kids, not only to the Juuls and other vaping products, but to those other lower cost tobacco products like the Swisher Sweets as well as the menthol cigarettes. The vaping companies, unfortunately, are using the same exact strategies that the tobacco companies have been honing for the last few decades on how to manipulate their products and content and creating new customers in order to addict new people, our young people, which are their future customers. We also want to see Alameda County not allow tobacco sales in pharmacies and set a minimum price and minimum pack size for the tobacco products because, as we've seen, those products are very cheap, 99 cents for 6 little cigars. That's incredibly accessible and appealing to young people. And we encourage you to join the dozens of other California communities that are taking similar action to regulate these product sales. And basically, I think the bottom line is that tobacco companies and the local retailers should not be growing their profits at the expense of our young people. Really need to prioritize their health. So thank you very much.
Arlene.
Good evening. My name is Arlene Cisneros, and I am here with BASTA, which stands for Bay Area Strength Through Activism. I live in the community of Cherryland, and I am here because the tobacco retail license ordinance is important to me. This is very important to me because I want my community, especially the younger generation, to grow up and be successful as well as becoming future leaders of the community. As we have seen, there is a large percentage of students that have already used e-cigarettes or vaping devices about 4 or more times and may have already become addicted. As a high school student, this makes me really concerned about my peers, and more importantly, this is why I'm here in support of the tobacco retail license for the unincorporated area. I ask you to please support this tobacco retail license as well. Thank you for giving me an opportunity to express my concerns with you about this issue.
Thank you, thank you. That closes the public portion. Council members?
I have something to say. I am thinking a little bit about how to really make it fair to both sides, people who both want to be able to use this product to stop smoking, but also to be able to protect our youth and our community. Perhaps what could happen is ban flavored tobacco products, but for instance, be able to allow an e-cigarette product that doesn't have any flavors, has a picture of grandma or something really, super uncool all over it. And, that is for people who want to quit smoking, but get rid of all the things that, the flavors that youth seem to be attracted to. Also, the other thing about the cigarette size or The packs being 20, I think that is a good rule. It would be a problem for people who are poor, but it would probably help keep youth away from cigarette products if they were more expensive. Yeah.
Okay, we're going on the line, okay. Listen, I heard a lot of comments tonight about the youth, and I don't think there's anything more important to all of us than our children. And we can't be naive that regulating something is going to keep it out of the hands of our children. It's all of our jobs as parents and adults to look out for our children in many ways and find out if they're doing this. So maybe I'm really a proponent of extremely tough penalties for the folks that violate the law. And there hasn't been, that I've seen, enough regulation from the federal government on what vaping should be. And, so I would say that tougher penalties, if you start getting into the flavor this, flavor that, and you got flavored alcohols the kids get wrapped up into. And I think I would be very concerned about taking away a lot of seniors and adults' rights to choose whether they smoke, chew tobacco, or vape. I happen to know an 80-year-old friend of mine that quit smoking and he vapes. And like I said before, it's a much pleasant environment to be around for me. I don't have to sweep up all the cigarette butts from the ground when we're gone for the weekend somewhere. And plus, I can breathe the air around me. I have a tough time with passing an ordinance when we don't know what the cost of the ordinance is going to be to the business owners. When we give somebody a blank check and we say, well, it's just going to be what it costs to implement the program or keep the program going. Well, the program could grow to a crazy size, and then the penalties would be pretty severe. So although I am 100% against any of this affecting the youth, I have a hard time supporting taking away the adults' rights because we're not managing our children better. So for that reason, I can't do it.
Can I ask a follow-up question for Paul or Rachel? Can I? Ted? So during public comment, somebody mentioned the requirements passed in the city of Berkeley and how it greatly reduced the use of these products in the youth. Do you have those numbers? Is that an actual, are there numbers, statistics for that?
I don't have, do you have this? Neither of us have the statistics specifically for Berkeley on hand, so I can't report on that exactly.
So
sorry.
When you talk about the 10 cities in Alameda County that have adopted these TRLs, are they really similar requirements across the board? Or do they vary according to each city?
They vary. So in the past year, City of Livermore, Albany, Fremont, City of Alameda have all passed ordinances, and they all have a lot of similarities to this. They're not all exactly the same, but most of them either have, all of them have some restriction, have banned flavored tobacco product sales, and most of them have also set minimum prices. City of Livermore did ban the sale of all electronic smoking devices. Oh, okay. So, do you know where it's from? If we find out where we got the data from, we'll get it to you. Sorry.
Chuck, were you done? I'm done. Were you done?
Yeah, no. This is really a tough issue because I understand the store owners, and it is their right. I mean, they need to make a living as well. I think I like Chuck. I mean, we should really crack down on somebody who is not adhering to the rules that we currently have in place, and it needs to be tough. Tobacco, I mean, e-cigarettes it's still nicotine. And I remember, and I think, Mark, that you were on this council when they first came here, and Cheryl, remember she tried one or something? Yeah. And the intent of the e-cigarette was to help people get off of cigarettes. And that's, I mean, it might have helped for some of our elderly people, and they're using that, but it has brought in a whole new generation of nicotine users, and that's a serious problem. It's a serious health problem. I have a 4-year-old grandson. I hate to see what's going to happen by the time, probably won't be here, but by the time he can make that choice. I think San Francisco banned the Juul cigarettes as well. The flavored products, for all of the people that were smokers since they were 13, 15, 20 that are now on vaping and whatever, they didn't start out with any type of flavored products other than, I think, a menthol. I think this ordinance needs to be tweaked. I'm not in favor of it in its current reiteration here. I agree, we need to know what it's going to cost, and I don't want it to impact the businesses that we have, but I also don't want to see the business grow. I don't like being around smokers. I'm a non-smoker. I would like us to limit it to the numbers that we currently have.
Shannon, did you have anything you want to say?
Stupid thing. All right. This, I have a few more things. So my concerns really, as I addressed before, was really the overreaching on the government regulation piece of this. However, you know, there is clearly an issue here. So there was something that was brought up tonight that was it was interesting by one of the store owners. And the thing is that the accountability's got to land somewhere. And so there's accountability in 2 or 3 different areas here, from the parents to the schools to the distribution. I mean, it falls in a number of places. However, having a business that has the ability to sell to adults and is heavily regulated against, I mean, if selling to any minors or children, and making it so ridiculously stiff that it keeps everybody in line. I am, you know, and looking at all these things, it looks like I'm not even sure if I'm in the candy aisle. I'm not sure where I'm at with this. If there was an ability to create generic packaging for all of it so that there was nothing interesting about any of it, and if you actually had to have it, you could, you know, it was there, and it had the ability to do something like that. I don't know. I mean, it's nothing but annoying. Smoke cigarettes, cigarette smoke, or vape smoke, or whatever it is. I don't like either. So, but that's not really what we're deciding here. We're trying to figure out how to manage this and move this forward. So, I'm not sure that the way that it's written 100% is something that, you know, I can support. But there's just, you know, like I said, there's a few things here that I think that we need to look at, and I think that there should be stiffer fines and just the loss of the ability to have a license to sell the products should be hanging over the heads of everyone that's actually engaged in selling any of these products. I don't know how they're going to deal with the online sales and some of these other issues, as I brought up before, but those are my points.
Okay, yeah, I think it needs to be tweaked a little bit. I don't want to take adults' right to choose, but I think protecting the children trumps all that. Mm-hmm. And I'd like to, you know, right now in its form, I'm not ready to vote that way, but I think the kids are the most important thing here. So I'd like to come back and see some figures on the costs, and then we can go from there.
Have you considered, I forgot your name, Paul. So on top of the fact that you're basically, you're targeting the distribution side of this, how do you see any of the accountability falling anywhere around? I mean, I understand the opportunity to kind of misguide parents and do things behind their back and pick something up on their way to school versus having to order it online. I can think of all of those things that can happen, but you know, I don't even know what the schools have an opportunity to do when they, you know, you catch somebody doing something. I mean, everybody gets in trouble for everything, so I'm not sure, you know, how does that handled in schools? I don't know.
First, we weren't trying to promote that tobacco products be bought online, and so I apologize if that was the message that you got.
No, but it's a reality.
Yeah. So I agree. I think that, you know, in order to support our young people, it takes a many-faceted approach. And so part of that is work in the schools, part of it is what parents and other concerned adults do, and part of it is about addressing the environment. And so the part that we're talking about today is specifically around addressing the environment, but it doesn't mean that those other pieces aren't equally important and really need to happen.
Yeah, I mean, I'd be interested in probably hearing more from the students that are dealing with this on a daily basis than half the adults that had something to say. I really do. You know, so it's going to be, it might be a little bit better.
Paul, I wanted to ask you a question, and you know, and all of the people from the high schools and all of these, where are these kids getting it? If it's, where are they buying it now? If it is such an epidemic and all of these store owners are saying they're carding them, is it online? Where are they getting it?
I work for the school district.
Okay.
I would answer.
Yeah. Absolutely.
Yes. Go ahead and introduce yourself.
Nick McMaster, Director of Student Services for Castro Unified School District. It's not, there's underage young people buying directly from stores. There's a lot of legal adults buying these and reselling them in the same way someone would shoulder tap for alcohol. Like, you know, I think you have valid points about the chains of responsibility. I can tell you at the high school alone, we have 7 administrators. So these are, you know, these are people like in my position. That's what I was in last year and the previous 4 years, where we are primarily focused on keeping the campus safe. We're looking at all the suspendable education codes from California as they set out the 48900 codes, of which tobacco use or possession was a suspendable code. We had a massive uptick in our suspensions, which is the most severe penalty we can hand out, approximately 3 years ago. And the state has pushed in along with the county with funding to acknowledge that we're not in scared straight tactics anymore. We have hooked kids. So we are taking a mental health approach to it. We're not a mental health facility.
Right.
You know, we've created counseling positions. The county's supporting us with that. We are trying to go the preventative route with education. We have, on top of those 7 administrators, we have approximately 8 full-time security safety staff. And I would like to say that 3 or 4 years ago, we were focusing on how to rotate around the campus to keep proximity to students in common areas. Now every single one of those rotations includes bathroom check-ins. So to say we could do more, we could certainly use a few more people. Right. But I'm telling you, I personally have hung out in a bathroom way more than I'd like to, and it's certainly not for the pleasant smell. The kid, I mean, we're talking about hooked kids. To say it's one singular issue, I think would be incomplete. There's multiple places where this is going wrong with many adults. It's not, to say it's the storefronts selling to underage kids, that could be happening, but that's not all of it. It's older brothers, it's people in the community, it's getting around, but it's in their hands, it's stuffed in their socks. By the time they make it to my office, it's prevalent. It's an issue, and no data could capture what we would see on a daily basis, which it has skyrocketed. And it's not a class-related thing. It's not one type of kid. It's every kid. It's the leadership kid. It's the athlete. It's the kid that looks like they're looking for trouble. It's the kid that's got a huge backpack full of textbooks and is reading in between break. It's out there, and it's not just the one kid just trying it. It's every type of kid.
So is there any data that shows that these, prohibition lowers that rate at the school?
I'm not here to speak to that. I'm here to speak to what we're experiencing in the schools. They're more expert to that. The data I know, They're relaying to me the new survey results, which will be out in January from our school district for grades 5, 7, 9, 11, and Alt Ed, will give you an accurate account of what the students see in terms of severity in the schools.
Hey, Mark? That one young lady wanted to say something.
We don't want to reopen the public.
Right.
Okay.
One question. Are you
We
seeing-
still have another agenda item.
Are you seeing this at the middle school age too?
Yes.
Oh, wow.
Yeah, not nearly as significant as the high school, clearly, but yes, we're dealing with it at the middle schools. Fortunately, not as severely, but it has pushed down, and the fear is it's just going to keep pushing down.
Okay, thank you.
Thank you very much.
I'm sorry, we have to stop at some point. We have another agenda item. It's already 8:35. Council members, Paul, what's the timeline on this? Is this one of those got to go to the Board of Supervisors last week things, or what?
No, it's not until next month.
That's the same thing.
Yeah. We're aiming to get it to go to the full Board of Supervisors on December 17th. So what we're planning is to present at the Fairview MAC on December 3rd, at Unincorporated Services Committee on December 4th, and then to the full Board of Supervisors on December 17th.
Okay, so that's pretty fast
Yeah.
tracked. So it's not going to the Planning Commission for?
No, it's not.
Okay. So this is our one and only crack at it, sounds like.
I think so.
Okay.
Yeah. She was trying to talk about the data, and so what the data showed was that the sales rates had been at 38% in City of Berkeley, and they dropped down to 4%. So that was an 83% decrease in violations, and so that's what the stat was. So.
Thank you.
So, Mark, are we allowed to make any changes to it, or is it
We can
either
make a
just yes or
recommendation.
no?
We can make a recommendation based on, what we think we should do, This is going to be countywide, so it will be for the entire unincorporated area. Obviously, we're going to look at it from the Castro Valley standpoint. I'll be honest, I'm not a prohibitionist. We dealt with this years ago with alcohol. We had exactly the same kind of hearings here. A lot of kids from the high school, the sky is falling, that sort of thing. And I'm not saying that this is not a significant problem that we're dealing with. I've just never found prohibition to be the answer in these situations. So council members, since we only have one shot at this, what I'd like to propose, the pages in the PowerPoint here give, an overview of the proposed TRL ordinance, and starting on this page here, which is not numbered, which is right after the federal and California laws page. So here's the federal and California page. All right, so the next page after that is the proposed local TRL requirements. It starts out with no selling tobacco without a valid local TRL. Okay, that makes sense. Prohibits the sale of flavored tobacco products. Prohibits the sale of all electronic smoking devices. My proposal, and I may craft this as a motion at some point if so motivated to do so, would be on this page to eliminate the second and third bullet points because that is prohibition to me. In fact, it starts with the word prohibit, so that's pretty straightforward. So as far as no selling tobacco without a valid TRL, I think the TRL, the requirement for the TRL is fine. I think the case has been made that we need that. We need closer oversight of the retailers that are selling this. Going on to the next page, creating pricing requirements for the sale of tobacco. I don't see an issue with any of those. I mean, I've heard the concerns about your basket of goodies over there being too cheap, and this is one way to address that issue, which I think is legitimate. The next page is creates tobacco retailing density requirements. This is very similar to what we do with alcohol outlets. I don't see any issue with that. Prohibits pharmacies from obtaining a TRL. I'd like to know, I guess, do we have pharmacies that are currently selling?
Walgreens, Safeway.
So they're selling those in the pharmacies or in the supermarket? Okay, so that's not a pharmacy. So I'd like to know if there's if we're, what we're doing to existing businesses with that one. So I couldn't vote for that without having the information on that. And that seems to be it. Paul, where's Paul? Am I leaving something out? I don't see anything else that says proposed TRL requirements. Oh, yes. Thank you.
You're welcome.
Okay, so going to, and this kind of goes to the point, Shannon, you were asking about, other jurisdictions. It's really all right there. I kind of like what Livermore did, which was they went a little bit stricter. The first violation was 30 days. The second was a year. The third was revocation. So they're the strictest on this page as far as getting to revocation faster. I would even propose going stronger than that, in the sense that, we need to, if you're not going to ban these products outright, they need to be extremely restricted in the oversight. So the only way that I could go along with not banning them outright would be to have very strict. I mean, I don't even understand why that you get to a fourth violation here. That seems pretty ridiculous. I mean, I think I'd go first, 30 or 90-day suspension, and second revocation. I mean, how many times do you got to be told not to sell this to to minors? I think if it was that strict, that you would have some pretty good compliance from the retailers. I'd want to go stricter.
You're going to go
30 or
first?
90-day suspension of sale of the products.
Right, so you're going to move right to that. So
30
first
to
is,
revocation?
no, it's
30 or 90. We can discuss that number, but first. Well, because why do you need to screw up 3 times before you get revoked? That's stupid. I mean, I don't get that.
Mark, there's a cost of implementing all of these things, and it seemed like to me that
Right here, annual fee.
right. Well, what I'm saying is, if you break the law, why not a 30 or 90-day suspension, and then a $1,500 fine, and then you know what I mean? Let's put some heavy
The 30
penalties.
to 90-day suspension already carries a financial penalty. If they're not able to sell the product for 30 to 90 days, their sales are going to go down, their profit's going to go down a certain amount.
But I was thinking more along the lines that the fine would be not unlike when you get a traffic ticket, It goes in the
Yeah, but then but I don't know how much profit there is in this stuff, and we don't have time to figure that out tonight. So
Mark, how
I'm trying to keep it clean and not get into the dollars side of it.
Well, Hayward has $1.
The last thing I want to do is follow Hayward's example. I'm sorry, but
City of Alameda also.
thank you very much.
Right.
Mark, and the board, the big problem with the teens, though, is the flavored tobacco
Get
products.
that. I get
It's
that.
about the flavors. They're attracted. They're things like called bubble gum, tobacco, whatever. And these are the ones that the youth are attracted to. If you didn't have the flavors, you could still have smoking cessation, e-cigarettes that really the youth are not as attracted to, hardly at all attracted to, unless they're already addicted.
What about adults that want to use the flavored products?
What?
What about adults that want to use the flavored products?
Well, I mean, adults can order them online, right? I mean, and they can be, yeah.
Well, then what's the point? I mean, if you're gonna throw in the towel that easily.
You would still have, if it's really about stopping smoking, then you can still have a product there that doesn't have the flavors that the kids are attracted to.
Yeah, that's the same argument that there was prohibition of alcohol in the 1920s, okay? A very small segment, it's a problem for a small segment, so it needs to be banned for the entire population. And I just don't believe, I fundamentally do not believe in prohibition. So that's why I can't just ban those. I mean, I could vote for that if we can't strengthen other parts of this, like the penalty side of it. If we're going to be as lenient as all these cities are, then yeah, I would say ban it.
If all
Because
these cities don't have the flavored tobacco products, they're all going to come running to Castro Valley for them.
I don't know that. It doesn't say that here. It doesn't say which cities banned which products. This is only giving us violations. So we weren't given that information to make our decision. We're not going to get it now. So
you know.
That was kind of my question.
Okay,
Yeah.
so Albany, Berkeley, Oakland, San Leandro, Livermore, Fremont have all banned the sale of flavored products. San Leandro passed theirs a couple years ago, and they created an exemption for menthol cigarettes. Oakland created an exemption for adult-only tobacco retailers that has turned into a mess, where they've got stores within stores, and we really don't want to promote that in the unincorporated area. But all of the recent cities have adopted ordinances that have included restrictions on the sale of flavored tobacco products, and I understand your concern about.
So when you say when you say include restrictions, is that outright banning or is that some sort of hybrid? This is pretty complicated, and honestly, I don't want to make a decision based on the verbal information that you're giving us right now. That should have been in a table here, right?
All right. So restrictions, yes. Prohibition on the sale, not on their use. So I just want to clarify that.
Okay.
Mark, I would support something like Livermore has. If we go to 60 days and in 2 years on the second violation, and then if you can't get it right in 2 years of warnings or violations, then I think yank your license. You're out of business. You're out of here.
I mean, 2 years is the same as revocation, is it not?
Yeah.
I mean,
sure.
That's.
Yeah, but I mean, that person can't come back and get a license again. They're out.
But if you're not doing nothing wrong, then you wouldn't even be dealing with these issues.
Yeah.
I would hope that if we do implement something where there's the, like a 60-day and a fine and the revocation piece, that the annual fee ends up being more reasonable. If they screw up, then they're paying for it right there on the spot. So that would give them a good reason to toe the line.
Is there?
But again, we still don't know where the culprit is for all of this. But it would clearly, the flavored, there's clearly a drop in every area that doesn't support the flavored tobacco.
Where are you getting that at?
Huh? Well, all the areas that were dropped, that were banned, Berkeley and these others, where they've actually had a reduced.
That dropped the flavor. Yeah. Is there a reason why this can't be postponed for 30 days?
Because it's going to the Board of Supervisors in less than 30 days.
But that can't be, no?
I don't think so. And usually when it's on a fast track like this, yeah, it's just either we do something tonight or it passes us by. That's,
I just wish that we had had more accurate information before crafting an ordinance that's going to affect, the unincorporated area. I wish we had more detail.
Mark, I think prohibition is not the right way of doing this, but I really believe that you come up with a severe penalties for the violators, and then
That's it.
and move forward with it. But taking adults' rights away, to me, is not appealing. And
okay, here's what I'm going to do. Is I'm going to make a motion that recommends. I'm sorry. The public is closed. The public portion is closed.
I know, I just
The
want to share.
public portion.
The
The public portion is closed. That means you cannot speak.
Okay.
So you need to go sit down. You need to go sit down. Is there a sheriff here? Do we have a sheriff here?
Don't do this.
Okay, you will need to be removed. You will need to be removed if you can't be quiet. This is a public hearing. So I want to make a motion to, starting this over again, on the first page here, going back to the first page of the requirements, no selling tobacco or any tobacco-related products, e-cigarette devices without a valid local TRL. The second two bullet points I would eliminate, which are the prohibition of the sale of flavored tobacco products and e-smoking devices. So I would not include that in the TRL. I would remove those two bullet points. Stop me if there's questions, council members. Second page creates the pricing requirements. I'm fine with that. Third page creates tobacco retailing density requirements. I'm fine with that. Prohibits pharmacies from obtaining a TRL. I don't have any information on that, so I would not include that in this motion because I haven't been given any information on that, who that affects. And then on the penalties, on the motion that I'm making, the first penalty is a 90-day suspension. The second is revocation. And that is my motion. Is there a second?
I'll second that motion.
Okay. All those in favor say aye.
Aye.
Aye. Opposed?
Opposed.
Okay, so 5 for, 2 against. Motion carries. So,
Opposed.
yeah. Okay. All right, we have another agenda item.
Just wanted to say thank you very much for your time.
Thank you. Next time, give us more time.